This session has perhaps the least scientific and broadest title, Strengthening Partnerships and International Cooperation. I think the reality is that this session has a kind of, well, what do we do now feel about it. And one thing I think that has come across very clearly from all the previous discussions is that tackling AMR involves dealing with lots of different stakeholders, whether it's the private sector, government and academia, whether it's players in the animal health arena or in the human health arena, or whether it's dealing with issues that cut across countries, both rich and poor. And this session is very much about how do we get the kinds of partnership, how do we get the kinds of working together that will actually make a difference. So we have 5 speakers, and we'd like to start with Dr. EVELYN Wesangula, who's the national focal point for antimicrobial resistance at the Ministry of Health in Kenya. So very much at the front line of dealing with how you integrate this in a country. Can I invite you to start?
Good morning. It's my pleasure this morning to be here to share with you experiences from another part of the world. Over the last day, we've had a lot of information. And for us, at the end of the day, the question we ask is, what do we do with all this information? Looking at all the priorities that different countries have, the perspectives, the level and availability of resources. So what happens next? And I want to share with you the experiences of Kenya in implementing the Global Action Plan. A lot of momentum was gained by different countries after the endorsement of this Global Action Plan. And I'd like to ask us to just have a look at what Kenya went through, breaking down the Global Action Plan into their own national action plan. A little bit of a background and the process of policy formulation as a country. What are some of the achievements that we have seen from the time the Global Action Plan was endorsed? What are the barriers that we face? And how have we managed to overcome some of these barriers? Because it doesn't matter which country is developing an action plan. At the end of the day, what we want to see is action. What we want to see is a reduction in unnecessary use of antibiotics. So barriers existing or not, these have to be overcome at one level or another. And what are some of the lessons that we can share with countries that are just beginning this process? And this can help shorten the time and probably the difficulties that we went through as a country. Kenya has a population of 48 million currently. And looking at our causes of death as a country, 5 out of 10 of the causes of death are infectious diseases. So what does that mean? The use of antimicrobials is not about to stop for as long as this kind of a landscape is still present. This also means that there is a need for diagnostics, improved rapid diagnostics. If we are to optimize the use of antibiotics, we cannot run away from the importance of developing new antibiotics and developing new diagnostic techniques that can facilitate the optimal use of antimicrobial agents, both in human health and in animal health. Our work began a long time ago, not so long ago. But the milestone that we saw as a country was in 2009. But prior to that, a lot of work had been done by different scientists in the research institutes, in the training institutions, in private hospitals that have good laboratory capacity. And there was evidence that there are rising trends of resistance in the country. There was evidence of overuse of antimicrobial agents, both in humans and in animals. So in 2009, we had a group of interested professionals, just the way we are gathered here, that came together and started a discussion on antimicrobial resistance. And they were facilitated by the Kenya Medical Research Institute with support from the Center of Disease Dynamics, Economics and Policy. So what was clear was that there was a growing body of evidence on the emergence of AMR in the country, but there was no action from the level of government. A lot of publications were out in the international arena, but very little was known locally. So in essence, all the information that was being collected was not helping the country to develop and implement policies that would translate to practice at the end of the day. So a joint task force was formed between the Ministry of Health and the Ministry of Agriculture, Livestock and Fisheries in 2010. And it's good to note that at this point in time in the country, we adopted a new constitution. This new constitution meant that the system of governance changes from a centralized system of governance to a devolved system of governance. And governance affects the implementation of any strategy that a country develops. So this situation analysis was made public in 2011. And between that time, very little happened, largely because of the devolution and the transition of the country from one system of governance to another. Moving on to 2014, a lot of activity happening at the global arena. The presentation of the draft Global Action Plan at the World Health Assembly. And this was followed by the endorsement of the Global Action Plan by the World Health Assembly in 2015. So in between these years, not much action was happening at the country level with government leadership. The working group was still meeting, but the level of commitment by the leadership in the government was minimal until the end of 2014 when we celebrated our second annual Antibiotic Awareness Week. That was when the government committed to begin the fight against antimicrobial resistance from the level that was required. We also had other initiatives that were going on that put AMR at the forefront. The International Health Regulations of 2005 had core capacities that required our country to report on the progress that we had made towards tracking antimicrobial resistance. We didn't have a national surveillance system. So this was a prompt for us towards the right direction. Then we had the introduction of the Global Health Security Agenda in 2015. At the beginning of that year, once again, the two ministries that are leading this process were prompted to increase the level of effort that they were putting towards addressing antimicrobial resistance. We had also developed national policies and strategies, like the Infection Prevention and Control Strategy, that recommended the establishment of an integrated surveillance system for AMR, and this happened in 2014, and also recommended the establishment or the appointment of a national advisory committee for antimicrobial resistance within the country. And all these initiatives adopted a multi-sectoral One Health platform that gave us a very good background for us to start engaging the country and the different stakeholders in addressing AMR. So the big job for us was breaking down the Global Action Plan, knowing that the challenge is global, but really the solutions to antimicrobial resistance must be localized as much as possible because the countries are different. So we had the work of breaking it down to our national policy and an action plan. And the debate was, do we go straight into an action plan or do we need a policy? And we had to look at our existing policies and look at what was relevant that directly discussed and addressed antimicrobial resistance. So in a nutshell, this is the process we had, and it's almost 10 years from the first time the multi-sectoral working group sat to begin discussing AMR from a multi-sectoral perspective, to the situation analysis, to leadership, to the advisory committees in 2015, and multiple consultative workshops like what we have now happening the whole of last year in Kenya. Initially, we thought it would take 1 or 2 meetings, but looking at the diversity of the stakeholders that required to be brought on board and realizing that we needed to build synergy and keep the momentum at the local level, we ended up engaging the whole of last year, building synergy so that we can come up with a coherent national action plan that will be owned by the country, taking into consideration that the system of governance is a decentralized system of governance. And finally, last month, we completed the process of developing the action plan. So we looked at the Constitution, we reviewed the sector-specific policies that we felt had a big impact on antimicrobial resistance. So we have the vet policy, the agricultural policy, the health policy, all of this endorsed by Parliament, and tried to find a way that we could leverage antimicrobial resistance in this. And we also looked at the existing international agreements that Kenya had signed to and committed to with regard to antimicrobial resistance. So just a picture of some of the people we engaged. And we have upheld the tripartite collaboration in our country very highly. We have made sure that at every step of our discussions, we've involved the FAO, we have the OIE on board, and the WHO as well as other stakeholders like the CDC, the feed manufacturers, all these people in one meeting discussing the way forward. And the members of the media, we could not leave this behind, and we've engaged them from the beginning. Our first media engagement was very interesting because the question that they asked us before they came was whether they are going to meet an AMR survivor in our meeting. And some of them didn't show up because we didn't have a survivor to produce. So that meant that our message needed to be broken down to levels that can be understood by everybody. So it has been successful, and right now we have an AMR media network in the country, and we continue to train them and bring this message home to the level that everyone can understand. And we've seen a lot of result. So we have an active multi-sectoral national advisory committee that leads this process. And through their leadership, we've developed a policy and an action plan from our One Health approach. It was not easy to build the team spirit because there was a lot of suspicion, but we have managed to build a team that's now working together. And we realized that some of our gaps could not wait until these documents were adopted. So as we developed the National Action Plan, we also developed the National Surveillance Strategy, because one of the weaknesses that was flagged out during the situation analysis in 2011 and 2016 was the lack of an integrated surveillance system. So we have been working alongside, as we developed the National Action Plan, we also developed the surveillance strategy, and we have begun implementing the National Surveillance Strategy in 4 pilot sites in the country. And we've also enrolled into the global antibiotic surveillance system so that we can share our information with the world. And to help communicate the risk of AMR, we have also developed a national communication surveillance, communication strategy. What are some of the barriers? Our biggest barrier to getting engagement at the highest level in our different ministries was the lack of awareness. AMR was a strange terminology to many of the people at the high level of policy making and at the level of implementation. And this was largely because we did not have adequate data on the economic cost of antimicrobial resistance. And we realized that our policymakers wanted to see numbers. What would it cost if we did not act? What can we save if we have interventions in place? So this is a gap that still needs to be addressed. Then we had disproportional representation in the advisory committee. And more often than not, the discussions ended up in the hospital. And yet we had the veterinarians and the agriculture representatives within the rooms. Then the different approaches to policy formulation. Funding of this process was a big challenge. We started on a zero budget and walked through it without specific allocations to this process. But we relied on partnerships, we relied on collaborations, and we knocked on many doors and asked different partners to support this process. Some of them turned our requests down, but some of them walked through this journey with all of us. And we had a challenge also trying to coordinate and focus partner support because you have different people coming in to support different areas. I want to share some of the successes we have had in overcoming the barriers. And a specific example is surveillance. Like I said, it's one of those big bites we have decided to take as a country because we realize that for us to see results, we must put systems in place. And one of the systems that we have started building is a surveillance system. We have no data and there's poor infrastructure. We decided we are going to work with the well-established laboratories, those that are in academia and some private hospitals that have really good labs. And we also agreed to leverage on the World Bank supported laboratories because the infrastructure has been built. So we only need to enhance the capacity of the people working there to be able to accurately detect and report antimicrobial resistance. We also said we didn't have capacity. So how did we overcome this? We agreed on an on-site mentorship program. We also agreed to adapt an online mentorship program using the ECHO model, where you can have different people mentored from different sites by a community of experts. So we are currently trying this out. We have seen successes in the tuberculosis program, so we have borrowed and because it's working. And again, in terms of epidemiologists, we have a field epidemiology training program. So we are working together with this workforce that is being built in terms of their capacity to be able to handle the epidemiology bit of the surveillance system. Strengthening of the lab information management system. We have this software in these hospitals, and all it needed was to upgrade the software to include a microbiology module. So we were able to overcome that. And with respect to the quality of data and the quality of work that is being done, we have now established a national calibration center. One of the challenges was calibrating of equipment. So this has now been addressed. We have learned lessons. And we realized that multi-sectoral platforms work best from inception. It's very easy to keep adding different players along the process. But if we can have all this at the beginning, that's a best approach. A key lesson we learned was that it's important to identify and clearly define the burden of AMR, because this is what is going to convince the policymakers that this is an agenda that is worth being put on the priority list of the country. And the other lesson is that government leadership and political commitment is critical. From 2009, we had a working group. There was no government commitment. There was no political leadership. But from 2014, when the government stepped in, we saw a big difference with regard to the way things moved in the country. Constant engagement with the country and the government levels. So this is our cabinet secretary. He's one of our biggest champions in the Ministry of Health on antimicrobial resistance, and he's been consistently pushing this agenda. And even recently, during the just concluded World Health Assembly, he was championing AMR there. We've talked about involving implementers throughout the process. We have used our students from the medical schools during the AMR Awareness Week, and they go out and engage the community in passing this message. And the other key lesson we learned was we need to be realistic. 2 years given by the World Health Organization looked like a lifetime, but we realized it was nothing. For a country that had already begun engaging, it took us a year and a half to complete the process. So for countries that haven't begun this process yet, it might take longer than the 2 years if you're to have meaningful stakeholder engagement. And finally, it takes persistence. It takes a lot of patience to get to a level where the stakeholders are all discussing the same thing with an understanding that each of us has a role to play. It takes building relationships, and that's why we are here. Collaborations and partnerships will help us achieve what the government cannot be able to achieve on its own. And finally, it takes building a lot of trust, because people need to understand that you're not targeting a specific sector, but you're all working for the good of the citizens that we serve. So that's the end of my presentation, just a brief snapshot into what the country has run through with regards to developing the National Action Plan. Thank you.